Hi everyone, welcome to the channel. Please subscribe and come back often to get valuable health information. For years, you've probably heard that a daily dose of aspirin can help prevent heart attacks and strokes. Now, suddenly, health authorities are backpedaling on this advice. So why the change? They claim it's about bleeding risk, but there's more to the story. Let's look at the timing. This shift comes as newer, far more expensive blood thinners flood the market. These drugs can cost up to $550 a month, while aspirin sets you back just $1.50. It's a pattern we've seen before with drugs like ivermectin. Safe, effective, and cheap medicines get pushed aside to make way for pricier alternatives. The pharmaceutical industry has a long history of this, dating back to when non-steroidal anti-inflammatory drugs, NSAIDs, were introduced in the 1970s. They're telling you to avoid aspirin now, but are they telling you the whole truth? As always, you should look beyond the headlines and consider who benefits from these changing guidelines. Your health and your wallet may depend on it. For decades, aspirin has been a cornerstone in the prevention of cardiovascular disease, commonly called CVD. A comprehensive review of 13 primary prevention trials recently revealed that low-dose aspirin is associated with small but important reductions in major CVD heart events, such as heart attack and stroke. The absolute risk reduction can be up to 2.5%, which means that for every 1,000 people taking aspirin, up to 25 fewer may experience a major CVD heart event. But the truth is, aspirin offers numerous health advantages beyond heart health that are rarely talked about. Learning about these benefits can help you take control of your health. Recent studies have shown aspirin's potential to prevent colorectal cancer and other types of cancer. Taking at least 75 milligrams of aspirin daily for several years has shown to reduce the long-term incidence and death from colon cancer, with the greatest benefits seen for cancers which are malignancies that occur in the first and middle sections of the colon, also known as the right side of the colon. In fact, in women, aspirin use for over 20 years was associated with a 35% reduction in colon cancer incidence, with longer use linked to greater benefits. Aspirin may also improve survival rates after a colon cancer diagnosis, with regular users showing reductions in cancer mortality of 25% and overall mortality of 21%. The benefits of aspirin use in colon cancer may extend to other cancer types as well. An analysis of 8 trials found that the 20-year risk of any cancer death was reduced by 20% and gastrointestinal cancer deaths by 35%. These findings suggest that low-dose aspirin use over multiple years could be a valuable tool in your cancer prevention strategy. Research has also uncovered a role for aspirin in treating certain kinds of liver cancer. A case study revealed that aspirin effectively controlled disease progression in a patient with liver cancer mutations caused by the scientific name Adenomatous polyposis coli. These mutations were identified as the primary driver of the patient's cancer. By administering high-dose aspirin, 300 milligrams daily, doctors achieved disease control for nearly 5 years. The effectiveness of aspirin in this liver cancer case is linked to its ability to inhibit the pathway, which plays a crucial role in cancer development. In patients with these mutations, the pathway becomes overactivated, and this promotes tumor growth. Aspirin works by activating an enzyme which destroys a key protein in the cancer pathway. This counteracts the effects of the APC mutation and acts as a cancer inhibitor. This case demonstrates how a common, inexpensive drug like aspirin could be used for targeted cancer therapy. Aspirin also has a protective effect against type 2 diabetes. An analysis of the ASPRI trial, which involved 16,209 adults aged 65 and older, revealed that those taking low-dose aspirin, 100 milligrams daily, had a 15% lower risk of developing diabetes compared to those on placebo. This finding adds a new dimension to the potential benefits of aspirin therapy, especially for older adults. The study also found that aspirin use was associated with a slower increase in fasting plasma glucose levels over time, revealing that aspirin might help maintain better blood sugar control, even in individuals who don't develop full-blown diabetes. While previous research on aspirin's cognitive benefits has been mixed, research published in Alzheimer's Research and Therapy highlights the importance of long-term use. The analysis found that taking low-dose aspirin for more than 10 years was critical for detecting a protective effect against dementia. This suggests that starting aspirin use in middle age and continuing it at least a decade may offer cognitive benefits. Aspirin's protective effects for dementia were mainly seen in people with pre-existing coronary heart disease. Among heart patients, low-dose aspirin use was associated with a 31% reduced risk of Alzheimer's disease, 69% reduced risk of vascular dementia, and 54% reduced risk of all-cause dementia. If you have coronary heart disease, it's possible that low-dose aspirin could provide dual benefits for your cardiovascular and cognitive health. Aspirin also enhances your body's use of glucose for energy while reducing the release of fatty acids from fat cells, especially linoleic acid, an omega-6 fat that's a major contributor to chronic disease, including obesity. If you decide to use aspirin, avoid coated extended-release versions due to their additives. Instead, get immediate-release aspirin. Check the inactive ingredients list carefully. Cornstarch should be the only one listed. The suggested dosage is dependent on your circumstances. A 82 milligram to 325 milligram tablet daily with your largest meal. If you're sensitive to aspirin, consider using a salicylic acid or willow bark supplement instead. When you take aspirin, your body metabolizes the acetylsalicylic acid into salicylic acid, which is responsible for aspirin's anti-inflammatory, pain-relieving, and antithrombotic effects. This compound is naturally found in willow bark. Overall, aspirin is a versatile and underappreciated medication with important health benefits beyond its well-known cardiovascular benefits. Thanks for watching. Please subscribe to the channel and return often for more important health information. Until next time, be safe, be well, and be prosperous.